Hi everyone, I'm Dr. Madhumita and you know me as MedicoMadhu. So today I'm going to talk to you about women's health. We always discuss how to take care of ourselves, how to take care of our family, but do we actually take care of ourselves? Do we know how much our body changes from the time we are born till we are pretty old? Well, today we'll be discussing about it. The minute a girl baby is born till she is 1 year old, in this period is called as infancy. How does infancy differ between a boy and a girl? We'll be discussing that. But in general, the baby's vaccination, the baby's sleep pattern, the way you're going to breastfeed the baby, everything is going to be the same. The difference comes when it is related to the mental development of the baby. Well, a girl baby usually starts her movements fast, she starts talking fast, but it is not for everyone per se. But if you notice that as compared to the brother, if the baby is talking much better or is quicker, then you don't have to be too concerned or too anxious. It is just a normal thing. Physiologically, as soon as the baby is born, if you're noticing that there is milk discharge from her breast, it is normal in the first few days. It is just the maternal hormone that is coming out. If you're noticing vaginal bleeding from the baby, don't panic. It is again normal. Actually, it just indicates that she is a proper female. You have to be happy about it. There is nothing to panic. It is absolutely fine. Coming to the infection of the urinary tract, it is more common in girl babies as compared to that of boy babies. So when the baby passes urine or stool when you're cleaning, you should always go from front to back to prevent infection. And if you're someone who is not using a tissue wipe, just using water to wash, then you just have to apply plain water. There is no need for soap or anything until and unless she has passed stool and stained. You just need to wash with normal water and just keep that area clean. Dab dry after you wash that area. The diaper has to be changed at least 2 or 3 times in every 8 to 9 hours gap. That would be a preferred one to prevent infection. Her perianal region can get infected early due to the moist content, so kindly take care of this. Otherwise, there is not much of a difference in the infancy period. The security factor is the same for both boy baby as well as girl baby. They all need their mother to be right next to them to inform them in the night that they are around and just pat them. The more you're with your baby, the more comfortable the baby feels. The preschool and the school age group, the early schooling. During this period, the girl baby and boy baby will have a little bit of physiological as well as psychological differences. So physiologically, again, since I had mentioned in the previous one, I would start with that itself. Infection in the urinary tract. The tract is smaller for a girl baby as compared to that of a boy baby. So that is the reason we keep telling the girl baby how to keep her private parts clean, how to use the toilet. So whenever the child uses the preschool toilets or the toilets in the school in the early childhood period, you have to make sure that the baby is cleaning her private part properly. Tell her to hydrate herself as much as possible. After she comes home, even if you give her a shower and clean the private part, it would be best. Another thing is, as a parent, kindly note if there is any abnormal discharge or if there is any injury mark in the baby. We have to take care of child abuse as much as possible. Please teach her the child abuse number that is shared on top. She has to be aware of it and she has to definitely communicate with you. The most important fear that the babies have is when someone abuses them, they tell them that we are going to threaten your parents. So that is what they are more worried about. So please make sure that the child is aware that no one can threaten you and they have to come and communicate with you, even if it is the teacher who is misbehaving. They should be vocal about it. Give them the confidence, give them the security factor. The night tremors are pretty common. It is not just for the girl baby, but also for the boy babies. They have it. So give them as much of security as possible. One thing that you have to be very careful about is the common rhymes and the common moral stories that they watch. For example, Cinderella. where the Ella girls, she gets cinder all over her face and hence she is named Cinderella. So here again we are talking about body shaming. You're putting it at a very early age. And over here, whether it is Cinderella or Rapunzel, you see that the villainous character is a female. So don't make them feel that the female community around them is going to be a threat to them. Started from a very early age. Apart from this, if you see, there is a godmother, fairy godmother who comes to help, or there is a prince who comes to rescue. Please make them realize that they are self-sufficient. Please tell them that it is all about, you cannot prevent the child from watching all these cartoons or all these short stories, moral stories. Please make them understand that it is about the good wins over the evil. It has nothing to do with the gender, and that they are self-sufficient. They can take care of themselves. They have to support someone. Please make them realize that they are the prince or the fairy godmother and they are not the victim. That is very important. So they should go and support someone who is in need. This is about the psychological part. When we talk about the physiological part, girl babies develop bladder control much early. So you can train them to go to the washroom as early as 2 to 3 years of age. Majority of the kids stop bedwetting the minute they go to their preschool or in the early pre-primary till they become UKG or first standard. But if you're noticing, you please start with alarm system. Just have a timetable as to at what time your baby is getting an urge. Just wake her up half an hour prior to that, take her to the washroom in the night and then come back. So this helps in gaining confidence in the child per se, and it also makes them feel that they are self-sufficient. It gives them a good control over their bladder as well. Coming to the physical part, you have to tell them that certain body parts should be taken care of, like the good touch and the bad touch. Which are the body parts that someone else can touch, which are the body parts that someone else cannot touch except for their mother or father. So you have to make sure that the baby identifies the gender difference, the organs, the parts in their body which are different from that of a boy, and it is absolutely normal. A lot of girl children have this insecurity because of the environment from which they come, because of the family from which they come. So please give them the support that their body type, that their color, their complexion, and the gender difference, the body type that they have as compared to a boy is all absolutely normal, and they have to accept themselves for what they are. The infection rate, whether it is the respiratory infection or the let's say gastrointestinal infection like vomiting, loose motions, these are common for both genders. But in general, the girl baby recovers faster as long as her nutrition status is good. And as compared to the boys, the girls might have a slightly better growth. That's because they attain their maturity full growth rate much earlier. Their development skills, that is whether it's the mental development, whether it's the language skill, whether it's the capacity to perform something, it might be slightly better than a boy child. So don't be extremely anxious about why your child is behaving in a particular way, or how your baby is basically acting, how she is talking. Now your baby is slightly bigger. She has touched her adolescence. So during the adolescent age group, we have both sort of changes that occurs, physiological as well as mental. So when we talk about physiological, they attain their puberty much earlier. They are much taller and their body has already taken in the shape of a young adult. So they will have their breast development, they will have hair growth in their body, they might have hair growth in the pubic area, and they might become extremely anxious about it. So kindly educate your child about it. She will be starting her menstrual cycle at this point of time. So you have to teach her about menstrual hygiene. If the child does not know about menstrual hygiene, the chance of her developing infection in her private part and in her reproductive organs is much higher. So kindly tell her about it. Some kids will be having thyroid related disorders, will be noticing changes like excessive hair growth in their face, abdomen area. They might be putting on a lot of weight. They might have gained weight all of a sudden. Their cycles might not be regular even after the first 2 to 3 years, when it is an anovulatory cycles where the irregular periods is common. So during this period of time, you don't have to worry. But if you notice anything that is off normal, then definitely you will have to take her to your doctor and get her evaluated at the earliest. It could be a thyroid disorder, it could be a polycystic ovarian disease, or it could be any other hormonal issue that she is facing. Mind you, it can be a stress related disorder as well, which causes extreme weight gain. The child might notice that she is having a little bit of taste difference. She has preference to certain type of food, or she is avoiding certain type of food. So it is your duty to educate the child about what is the right type of food that she is supposed to take, with lot of vegetables, fruits. The necessity of exercise is more important for girls to strengthen their bones. The early life they start with exercise, it helps them later on when they become elderly. It prevents their risk of osteoporosis. So train your child to go for regular exercise from this point itself. The best would be to start from the early childhood, but at least by adolescence we should make sure that it is a part of their routine. Other than this, they will be very curious about sexual activity, because at this age they are just coming to know about it. So it is your duty to educate them about sexually transmitted infections and the need for avoiding early onset sexual activity. The harmful effects can be early pregnancy, it can result in early abortions, miscarriages, and it can be detrimental to their very future. It can result in a lot of infection. So this would put a lot of mental pressure as well on the child. So it is very important for the parents to communicate. As we have all crossed the adolescent age group, we all know what thrill it is. We are high on hormone level at that point of time. So don't be a parent, be a friend. Kindly discuss it with an open mind and make the child understand about the risk of abortions, early pregnancies, etc. So this helps the child. If your child is avoiding you, talking more with your friends, it's okay, accept it. Just make her realize that yes, during your age I also used to be like this. You must be enjoying it. When you give a positive remark, she will be encouraged to come and talk to you. You should just tell her, remember that you also have one friend at home. You can always come and share anything with me. I won't pressurize you. The day you feel that you have to share it with me, I'm always there. So she needs that assurance. Kindly give her that. That is all that is recommended. Apart from that, you have to take care of their diet and physical activity. I am re-insisting because this is the age group when they develop anorexia or bulimia. So anorexia is avoiding any type of food and going into starvation to maintain a very thin figure. And bulimia is you're not able to control your hunger, so you end up eating a lot and then you vomit. So you're practically not very thin, but at the same time you're not eating the right type of food. So these two have to be avoided. So you have to make the child understand that there is no need for her to be worried about her body. She just have to be fit. It is not about how curvy or how thin or how voluptuous a person looks. So this is very important. As a parent, it is your responsibility to make the child realize it. With this, I conclude the current video. I will be continuing with the reproductive age group and further on in my next video. Stay tuned, follow me, follow for the next session to get update on women's health, and also follow me for further videos.